That looks like everybody did. Perfect. All right. So maybe start us off with a good story about something that's happened maybe this past week with COVID-19 and uh, give us a little insight on what you're experiencing in your world.
Yeah. So I'm an ICU doctor, and that means that anybody who gets COVID and kind of gets sick is going to be someone that I'll get to take care of on some level. And that also means I kind of know every patient that comes in and out of the Palmerado and Palomar up in Escondido Hospital. So that's the Palomar system, and I'm the director for ICU services there. So I've been able to kind of have my finger on the pulse of what's going on. I also am a national director for about 20 other hospitals. And I'm kind of like a coach or something, or a facilitator for medical directors. And we all get together literally 2 times a week talking about what's going on with COVID. And I've got somebody in New York, which it's just crazy out there, Chicago, which is not quite as bad, and then my California people, which is where kind of most of the folks are that I talk to. And one thing that I've come away from this whole experience is I'm so glad I live in San Diego. It's just, we are so fortunate. We're relatively spread out. We're not on top of each other. Our weather is good. The transmission of this virus goes down with warm weather. And, there's a couple reasons for that. One of them is just, sunlight kills the virus. Another one is warm temperatures have higher humidity, which means that droplets just don't stay in the air because they hit a water molecule and fall down and end up on the ground. And also we're just not as packed together. So, just like the flu season is worse in the wintertime, this is a similar respiratory disease. And so it's hitting us later than other parts of the country in our good weather with our spread out people. And California's been on lockdown because of things that were happening north of us in Santa Clara outside of San Francisco. They had some real major stuff. I don't know if you guys saw this. There were actually a couple cases that are being identified as having occurred like 2 weeks prior to any previously documented deaths. I don't know if anyone saw that in news yesterday, but some samples were kept on some patients where the coroners just didn't know why these people died and suspected it could have been the flu, or I'm sorry, corona, and it turned out to be true. So in other words, it's been in California. We went on lockdown well before it entered our communities and down here in San Diego. And so, I feel pretty good that we're going to make it through this with just kind of a slow trickle of patients. Joe, when we talked the other day, I think I told you we'd just gotten a couple people off the ventilators. And right, I can't remember if I had one guy that was on for like over 3 weeks, and we just got him off. And
Yeah, that's what you're saying. 3 weeks, and
yeah,
we know a little bit from the news. We all become now expert doctors, right? Because we watch the news.
yeah.
So yeah, but the reality is we have no clue. But when someone's on a ventilator for quite some time, that's a little bit scary, right?
Yeah, it was scary for me, and it was scary for him probably, and his family even more. His poor wife and I talked every day. We talked every day. Take care of him. But in the very beginning, she kind of had some symptoms, and I was like, "All right, come on in. Let's get you tested as well." Unfortunately, she didn't have it, but I can't imagine having your husband on a machine for that long. Um, one thing, we've had younger patients in San Diego than I've seen across the rest of the country, and I think it's because we went on lockdown sooner. But I will say this to make everybody feel a little bit more comfortable. These younger patients are still people that have significant disease, and so dialysis people, uncontrolled diabetes, people with a whole bunch of other diseases. I haven't had too many young healthy people, and the ones that did, like there was a guy who came in and he was like, yeah, when we knew the state was going on lockdown, we threw a big party, and literally he got coronavirus. I don't know if he got it at the party, but he had it, and that's what we
Wow.
were identifying. And but he was young, and he was out of the hospital 3-4 days later. And so I think that the people we have to protect are not the people that can ride a bicycle and get outside in the sunshine. The people we have to protect are people that are not. I don't know why I came up with that analogy in my head. I think I've just been seeing everybody riding bikes around. It's like, and I thought of this though, and all the people I've had on ventilators, I don't think any of them would be able to ride a bicycle, prior to coming in. And so just kind of a thing, one, we all need to just take care of ourselves and stay healthy, because that is a big part of not getting sick, I think, from this virus.
You were also mentioning how, thankful that we live in California because there's a certain capacity that you as a doctor have in terms of being able to take care of patients. And
Yeah,
so that idea that we actually did go on lockdown while it was stressful for everyone, teachers, parents, students, and that physical distancing piece, we're trying to navigate that. But
yeah.
there's a reality to that has actually paid dividends in a positive way for you specifically and other doctors in California.
Absolutely. I find that taking care of, 5 or 6 people on a ventilator with this disease stretches me just a little bit, and I'm putting in longer hours. And, just because there's so many facets to it. It's a really complex disease. And there's things we don't know about it that we're still learning. Uh, Out in my friends out in New York have literally 30 patients, so they've got 6 times as many. And there's no way, I mean, they have to, cut corners on some level in terms of their care, because they didn't do that. They didn't have that social distancing thing happen until they were already well into having spread. I don't know if you guys saw this thing. They tested antibodies in New York people, and something like 20% of them have been exposed to this virus. And so, did you see that? I think that was today in the news. And so I'm sure if you did that down here, we wouldn't come even close to that, because we've just been, locked down when we saw what was going on out there.
So your recommendation is that it's the right work that we've been engaged in. Parents, you see the county office, the
Oh,
governor saying, "Hey, we're going to lock this thing down for 18 more months." And you think about this, we've had the flu, there's no vaccine, and people are talking about vaccine, but you think there might be a reality change with this, and maybe give us some perspective on that.
I don't. So, first of all, I'm an optimistic guy in general. And so I think there's going to be a vaccine. I think that there's going to be some medicine that's going to come out. By the way, I don't think it's hydroxychloroquine, but I think that there is a medicine that will come out at some point and be more effective than nothing. And I think that we are going to move from the containment of a disease in our community to the mitigation of getting that disease into our community. In other words, I think we're going to take a step back from where we are. And what that means is maybe we get a rapid test. If I want to know if I have the flu, I can literally go to like 30 places within 4 miles of my house to get a flu test. And that, then if I have the flu, it changes my behavior. I don't go hang out with my kids anymore. I isolate myself in my bedroom because I don't want them to get it. I probably don't hang out with my friends. I'm not going to go into work, and I can get that result in a matter of an hour or two. And so I think there's going to be a rapid test for COVID eventually, and it will be in all of our urgent care centers. Right now, if you're going into urgent care center, they're probably going to send you to an ER to get tested. And so there's this whole ability to maybe mitigate the spread if we can just get more testing. And so that's going to come as well. So I'm optimistic that we're actually going to be heading into the winter, which this is, we call it cold and flu season. It's now going to be cold flu coronavirus season, and it's just going to be another one that we have to deal with. But I don't think we're going to be without tools like we were for this first part.
You're also mentioning around the massive impact financially on the system, while the flu and even Ebola, right, hasn't gotten this kind of attention. But you're thinking because of this massive kind of impact that there'll be a lot more resources putting towards actually creating something that is going to make a difference.
Yeah, it's funny. I saw this TED talk by Bill Gates, and he said, we're going to get one of these viruses, and it's going to take trillions of dollars out of the economy. And it was from like 4 years ago. That is what happened. And so I think we see that. And if you're going to, you were telling me you went to South Korea, right? And they were checking your temperature in the airport. And we don't do that, which is, crazy when you think about it, because we move around so much and there's so many of us. And so I think there's going to be probably a lot of money put into infrastructure that does things like assesses somebody's temperature who's walking through the airport. And instead of just having us take out our 3.2 ounces of shampoo or whatever, there will actually be a temperature scanner as you walk through that as well. And then they'll pull you aside and say, hey, your temperature's 104. Maybe you shouldn't be getting into this small metal tube with all these other people, that sort of thing. So I think it's going to be a game changer for us for sure.
Yeah, one of the things that, there's a lot of conspiracy theories out there, but there's science behind the reality of how this thing probably got transmitted.
Mm,
And you were mentioning a little bit around animal transmission, and it's quite interesting how that might have happened, and specifically bats. Can you tell us
right.
more about that?
Yeah, I thought that was just kind of an interesting thing, that why bats, right? Why are bats the source of this crazy virus? And they've actually been the source of other ones. And when you think about it, bats are mammals with this really high metabolism because they can fly. There's no other mammal that can do it, right? There's, the metabolism of a whale who's just kind of floating through the ocean with all of his blubber is really low, and their heart rate is super slow. And then you kind of move up the chain, and when you get go through lions and tigers and whatever, and their metabolism is probably about what ours is, but you get to a bat and their heart is literally going hundreds of times a minute. They're churning through energy because they can fly, and their immune system, same thing. They've got this immune system that's like an immune system on steroids, and so they have these really nasty viruses that go through and develop within them, but they're able to kind of fight them off. And but for us, that means they're a reservoir of particularly virulent, bacteria, viruses, and so that's why it comes out of bats. As far as how we got it, yeah, I don't know. Probably somebody ate it. That's my guess. I've seen plenty of assessment saying that this is not a weaponized virus, and I would find that easy to believe that it's not. I think it would probably be a lot worse if it was. And I think this is kind of like a bird flu sort of thing, and it's not the first time we've had a bat virus that's come into humans.
And you were mentioning a little data even further around weather, and specifically for each degree change that
Yeah,
does something. Yeah,
yeah.
interesting.
That was so there was just an assessment of transmission, and for every degree Celsius, actually, that you have an increase in the ambient temperature of a city, the transmission rate is decreased by 13%. And so there's, as we were saying earlier, sunlight definitely kills this. Uh, Having warm weather adds humidity to the air, and humidity captures the virus and drops it down to the ground where we don't tend to ingest it. And then there's also just the fact that people are around. So warm weather, and I've been watching not just the death counts in New York, I've been watching our weather forecast here. And seriously, and when I see weather in the 80s coming up for the next 10 days, I'm sitting there going, yes, all right, this is going to help mitigate this virus just a little bit for us.
Yeah, that's fantastic. So I appreciate that as well. You are a dad,
Yeah,
and I'm sure this thing kind of scared you, even being a medical doctor and director, and
yeah.
kind of showcasing this and talking about it with all your professionals. So, like, how did you feel about this process, and like, recommendations, suggestions for parents right now and moving into the summer?
So, I think that I've I have actually, even as a doctor, I'm ashamed to say I have not been the best hand washer in the world in my life. And my wife actually has, it's like, she's been on me about washing my hands more. She's like, oh, you just came from the grocery store. You should wash your hands, pre-coronavirus. And I was just like, what? Come on. I'm just outside. There's nothing going on there. It's changed my behavior from that perspective. And I take a lot of comfort knowing that kids don't really get this, and when they do, they don't really get sick from it. And that's been such a silver lining for me. I have docs that have their parents living in their houses with them, and it's a thing where they have to just isolate themselves in their rooms and not see them and stay away from them. And I think that makes sense. For me, it's everybody in our house is healthy. We don't have any major medical problems, and the kids are young and they're not babies. I've got a 4-year-old and a 2-year-old, which are so for me it hasn't been as stressful, but it has made me wash my hands, take more showers than I used to, in terms of like coming, when I come home from the hospital now, I take a shower before hugging anybody and change my clothes. And there's clothes that come to the hospital and I change into these scrubs as soon as I get here. So it's changed behavior that way. I think, I will say the uh, having the kids around the house, as much as I wish they were at school, it's actually also been a blessing, right? Which is that we've kind of gotten to know everybody a little bit more. And, mine aren't out of the house that much anyways, but, I have seen some positive things coming out of this in terms of families and people just kind of getting to know their parents again, and just being home more. So there's some positive stuff there.
Yeah, I'm one of 10 kids. I have five sisters and four brothers. So we do this weekly Zoom call with our family. And it's crazy, chaotic. And
Yeah.
it took COVID-19 for us to get together each weekend. So
Right. Yeah.
yeah, so we're looking at the silver lining and the reality. I know this is not a scientific statement that you want to make about July, what's going to happen in July, but the idea that we look at things with a silver lining. And any predictions for July?
So I think you had asked me when I think we'll kind of have all this stuff lifted. I think definitely July 1st has been the day in my head for whatever reason that I'm kind of thinking. Yeah, certainly as May 1st gets closer, we're all realizing, okay, this is not going to be May, right? This is going past May, and so I think there's probably going to be some sort of easing in June. July, to be honest with you, football season's not going to be what it was last year, and that's going to be August, September, right? I think they're going to run the games, but there's going to be something different. Whether or not it's fewer people there and everyone wearing a mask, whether or not it's just more hand washing stations, or maybe they'll sell every third row or something of ticket. Like, I don't know what's going to be different, but there are some things that are going to be with us past July, which are these massive events, big concerts, places where people can really get this virus, because it's not going to be out of our community yet. But I think in terms of us feeling safe to go to the grocery store, I think we're all going to be wearing a mask for a year at least, and I think people are going to be going to the grocery store wearing a mask, and I think that's okay. But in terms of us going out at the park, hanging out, being in closer proximity to people, I think that's probably July is when that's all going to be opened up, fully again. I wonder things like playing basketball at the LA Fitness, right? Like, you go play a pickup game there. Is that going to happen? I don't know if that's going to be happening July and August, but at some point it's going to come back. I think there's probably going to be, once we get this widespread testing, there's going to be kind of a knowledge about what communities have it denser and less dense. And so, maybe if there's a lot of disease in Santa Clara, the gyms maybe won't be open for group activities. And if there's a lot less in San Diego, then maybe it will be, that sort of thing. I wouldn't be surprised if we start doing just much heavier surveillance of disease, and then making recommendations in communities based on like a scale of 1 to 5 or something, kind of like
I
fires.
remember, yeah, pre 9/11, I wasn't taking off my shoes at
Yeah.
TSA, right?
Yeah.
So we know that these things kind of are there to protect us. That leaves parents, Design 39, one school
Yeah.
has 1,200 kids.
Yep.
And that's, you say that, the silver lining is our kids aren't getting it. It's the health compromise. But yet, what would your recommendation be to, education systems and schools? And those are large bodies who are trying to come together for learning.
Yeah. So D39's got this really wonderful, open, large campus, right? And you don't have a bunch of people crammed into a hallway. When you go from room to room, you're actually going outside a lot of the time. And so you're actually, and in San Diego, right? So I think that there are some places like Design where it's actually going to be feeling a lot safer. I remember going to some of the inner city schools in like Philadelphia, where I was doing some work out there, and those places were dark. Everyone was crammed in, yeah, and that's a different story. So I think
Yeah, we got a lot of windows,
we got
a lot of
oh yeah,
sunlight.
beautiful, right? And that kills it. So so that sort of thing. Yeah, I don't know if you guys, if I think I would feel comfortable sending kids back to school, and And
What date? What date would you feel comfortable with that? I don't want to. We're only YouTube live, so no problem. This is only recorded.
well, fortunately, my opinion doesn't matter. I would say, if I think I would be feeling safe, it's not going to happen this year, right? I don't think that's going to happen this year. So, but when the school season starts up next year, absolutely. And if somebody said to me, "Hey, they're going to offer classes right now for people to go," starting whatever, May 1st, even would I send my kid back now? I might even, I'm feeling really a lot better over the next couple of weeks here. We're having fewer cases here. The weather's warming up. Things are looking a lot better. I don't want to tell anybody, hey, we're all safe and we're past the storm, because you just never know. But the reality is, I think we're making it through.
So you taught me a new vocabulary word. I heard about intubate. What's the
Oh
word when
yeah,
you take it out?
extubate. Yeah, it goes in the tube or ex the tube, right? And
Gotcha.
yeah. So we've been extubating, more people. We're getting people off the ventilators, and back to the medical component. There was a study that was made it through the, I don't know. I get calls about it. I haven't had the chance to watch any TV lately, but they were saying like 80% of people in New York, once they go on a machine, are dying. I don't know if anybody heard that or not, but that number is way wrong. And it's wrong because what they did is they reported the number of people that either died or got better, and the vast majority of people are still on a machine right now in terms of that particular study. And so that number was one that shouldn't have been reported.
So it was
In
skewed.
It was very skewed. Yeah, they reported on 300 people that had an outcome, but there were, I think, 1,200 people that were still on the vents, which are presumably more than 80% of them are going to get better. Um, as far as our population goes here, we've been able to get more people better than not, and the people that are on the machines are most of them are getting better. I had to put somebody on, last night, but that's we're going to get a case here and there. I think every few days or every week or whatever, we're going to get one. But we're that surge of patients. I'm hoping that we're kind of through that for a little while. Now, that
So
being said,
oh,
don't go.
sorry.
I was just gonna say, don't go visit grandma in her nursing home. We're not ready for that yet. No way.
So I know we have 5 more minutes. We need to make sure you take care of those patients. I have a question here, and maybe we'll open it up if you have like 2 or 3 more minutes from a question. There's a question here from one of our parents. Just again, thanking you so much for making yourself available. Uh,
Absolutely.
have you heard about the research on reinfection?
So yeah, good question. I think, and part of that question is also, if you get an antibody test, does that test tell you you're safe? And just, on the antibody tests, there are at least 15 out there, and the majority of them are about 30% accurate, and 30% is pretty bad. And so I haven't gone and gotten tested myself. Uh, Most of them will test for any coronavirus, and so they can't differentiate COVID or not. And so, I don't want people to go get that test at a clinic, which you can go pay $200 for it right now in San Diego, and then say, okay, good, I'm good, and go visit somebody with known COVID, because that would not be a good idea. There are some folks that say the reinfection rate's about 2%. That's based out of things that we've observed in China. There's a much more recent, like this week, report from South Korea, where they had the estimate to be about that as well. So you are protected, and there will be a herd immunity from exposure, right? But it's not foolproof. There's a 2% risk, and that's significant.
So our body is a pretty powerful machine to be able to kind of navigate and heal itself up.
Yeah, most people get this and they're totally fine. They're estimating. They did this looking not at New York City but at New York State, and they found 13% of people have been exposed, which means that there are millions of people that got it and just had no problem with it at all.
So just to clarify, we chatted a little bit about school being closed. That's for this school year, 2019,
Yep.
2020. So 2021, we're looking at having that open. That's our best hope.
I think you will. That's my guess. Obviously, that decision happens way beyond any
Right.
opinion I have or any opinion you have, even probably, and that's a governor's choice. But
Yeah. But
that's
not
my
getting back in May and June.
no, I wouldn't expect that.
Yeah.
Yeah.
So here's a question. How deep has the contact tracing been at your hospital? For example, have you seen a percentage of infection from asymptomatic people?
To be honest with you, we kind of are past that ability to do contact tracing these days, just because there's so many patients, and so I think there are asymptomatic cases. Um, Most people, I don't, so I have multiple family members. So I've had at least three sets of people that live in the same house that got it,
Oh,
and
wow.
uh, and so I'll know in that case, this person got it from their brother or sister or their
Okay.
husband or wife, that sort of thing. But in terms of knowing outside of that, other than that guy who went to that concert, I'm assuming that's where he got it. But no, I haven't really been able to trace this. And I'll ask the families, known COVID exposure, travel, et cetera. We kind of stopped at least a month ago asking that question, just because most people are just getting it in the community these days.
Yeah, my father-in-law, he's 65 years old. He was sitting at a conference table for his business. About six people at the table. Four of them were infected, and the two weren't.
Wow.
So, yeah, it's kind of crazy. He had to stay home for about 3 weeks, but
You didn't get it though?
no, he didn't. Yeah,
Wow.
yeah, they tested him and all that. Yeah,
Yeah,
craziness.
there is a prison in Ohio, and over 70% of the inmates have it, which makes me think probably 100% were exposed. And, that's not the same as our population. Those guys are constantly in each other's face and living in the same rooms and that kind of thing. But it tells you that there are some people that probably just don't get it.
Yeah. So, do you have maybe 5 more minutes?
Yeah, sure. Yeah, I don't
Okay.
start till 7, so I'm
All
good.
right. So we're going to open up. If someone wants to kind of raise their hand, and then we'll put you up on the microphone here. And I think we have one more on the chat. Do you think it is okay for San Diego to open the beaches this weekend, this month, or any other places that you think might be wise to open or not? And then raise your hand if you have a question for Doc Butler here.
So, my opinion about the beaches is completely uninformed. And no, seriously, it's like that's the kind of stuff I just don't know. If you said to me, would I feel safe going to the beach if they opened it this weekend? I would. And I probably wouldn't plop down next to somebody else that I don't know, but I might go out to the beach and hang out there in the sand or something, away, socially distant from people. I think San Diego's opened up a bunch of parks, and that's great. I think stay socially distant and you're fine, right? So, and what socially distant means is basically when somebody coughs, those droplets shoot out for about, whatever, 6 feet or so, and then they all fall to the ground. So once they're on the ground, they pretty much die and you don't have to worry about them. But if you're close to somebody who coughs, which I don't know if you've been in a room lately when somebody coughs, but everyone jumps back now. It's like, they're like, whoa, whoa. They're like, oh, it's just my allergies. Like, sure it is, buddy. Get out of here. But so it's really about coughing, or people that touch their face and then they shake your hand. That's the other way you get it, right? And so
Yeah, yeah. The new high five, right, was like
the
giving a
fist bump.
foot bump.
Yeah,
Yeah. Hey,
yeah.
I see Dr. Fadi. I see you're in the room as well. Hey, Dr. Fadi, how are you?
How are you?
Good to have you. I have another question here, and I was surprised to find out asthma was not listed as a pre-existing condition. Do you see that being accurate in clinical practice?
So I don't know that asthma is not considered a pre-existing condition. Depends on what study you're looking at, and because I have seen some where it is, and I've seen some where hypertension is as well. Which, to be honest with you, if someone's on a hypertension medicine, it makes me wonder whether or not this is somebody who's really at risk of COVID, right? But I have seen it listed as asthma. So I guess my question, Hunter, would be, what was it that you were looking at that didn't have it listed that way?
And you can
Um,
go ahead and yeah, and we'll take questions as well live if you'd like.
yeah. The other thing I was going to say, by the way, is in terms of the people that I'm seeing get sick, it's people with kidney disease and uncontrolled diabetes. Those are the big ones. And so, if those are the people, and those are the people to keep safe as well. So if you're a dialysis person, you shouldn't go to the beach this weekend, without a doubt. If you have diabetes and your hemoglobin A1C is above 7, then don't go out in public right now. Get that stuff under control first, and stay safe.
Hey, Dr. Fadi, you want to say hello?
Yes, and I was gonna chime in on things, but unfortunately, my dog decided to bark.
Hey, it makes for a good conversation here.
Yes, it's a husky pup, and it has all the energy of a husky and all the youth of a pup.
Hey, I know you work there in the emergency room as well. Is that right?
Yeah. So I'm a trauma critical care. So kind of the mirror image of Dr. Butler, but on the surgery side.
Yep.
Fortunately, we have not been dealing with coronavirus as a group because our medical intensivists like Dr. Butler are taking care of the coronavirus at our hospital. I work for Scripps La Jolla mostly. But to chime in on some of the questions that were asked and Dr. Butler's response, I think the people at risk are the people that have heart disease or their vessels are not that good, I think. And again, this is my suspicion because the studies that showed the people at risk are people that have high blood pressure or heart disease or diabetes. All these are risk factors or problems that make the blood vessels not work well. So that's why maybe asthma is not as relevant, but people that have a big weight or lung disease are not really spared, but are less, maybe get less sick. Again, this is my observation talking to the group that we work with here and reviewing some of the studies. I'm actually in a WhatsApp group that had a bunch of physicians from the American College of Surgeons all over the US. And that's what I'm hearing from them. And I chime in again, like reopening too soon without having the proper testing for the virus or testing for the antibodies and knowing if the antibodies actually do give you immunity or not. Would not be a smart move, especially if we open big all the way. Maybe I agree, maybe opening a little bit the parks or a little bit the beaches with really reinforcing that social distancing remains is going to be relevant.
Hey, Dr. Fadi, I know your puppy there doesn't want to be physically distanced from you. So
no.
Hey, so Fadi's the one that also helped us kind of translate that from socially distancing to actually physically distancing, because it's not about like socially distancing ourselves. Right. So I really appreciate that, Dr. Fadi. We'll let you put your mute on, and we'll probably take a couple more questions. And thanks for joining us.
That is a good point. Physical distance is different than social, right? Because we've got all this, these mediums now to be able to FaceTime, and just kind of hang out. And I haven't had a FaceTime happy hour with my friends, but I know a lot of people have, and I'm trying to get one set up this weekend where we just hang out like this with a drink,
All right, I don't see any further questions. We'll leave it open for about 10 more seconds. Anyone unmute your mic if you want to say something? All right, Dr. Butler, any final parting words of wisdom? And
just everybody stay safe. I think keep those masks on for a little while and wash those hands. Take comfort knowing that we're in the best possible place to go through this, and that our kids are all adapted to FaceTime and able to weather this by hanging out with mediums like this and just kind of keep it going with them.
Like you said, enjoy the time that we have with our kids and embrace them. Give them lots of hugs, right? Yeah. You've been amazing. We really appreciate you. Keep taking great care of those patients, and thank you for making time for us.
Absolutely. All right. I'll see you guys soon.
See you later.
Thank you.
Thank you.
Thank you.
Take care.
Thank you. And if anybody else wants to stay on, I have just a couple little mini updates. And so if you want to, I'll show